Once you have selected the correct model, size and density, advise the patient to replace badly worn shoes, as these may reduce biomechanical effectiveness of the product, and make sure the patient is wearing both shoes and socks for the moulding procedure. Remove inner soles, arch cushions and thick linings from the shoe, and once this is done, heat one orthotic at a time by holding the distal edge of the ICB orthotic. Place the heat gun 15 to 25 centimeters away from the plantar surface. Heat for 20 to 30 seconds in a circular motion until the product softens. The words right and left will smooth as an indicator of the right amount of heat. Heat dorsal area and arch and heel area for approximately a 5 to 7 second burst. Do not overheat the product by concentrating in one area, as hyperelasticity may occur. Place the product into the footwear. Hold the product in the heel cup with your thumb. Place the patient's foot into the shoe and ask them to stand with equal weight bearing and feet equal distance apart. Keeping their feet straight, place foot in the subtalar neutral position. Maintain the position for 30 to 40 seconds. Remove the orthotic and allow to cool. Then repeat with the other foot. Do not allow the patient to stand on the products after they are moulded for approximately 2 minutes or until it is cooled after the customization procedure. Add additions as required. Suggest that the patient wears the product for 1 to 2 hours at a time and allow the product to settle in for a period of 2 weeks. If irritation occurs, take the product out of the shoe and allow the inflammation to subside, usually a couple of hours, then continue the pattern. If heel slippage occurs, choose shoes with a high heel cup, or if the shoe is tight across the transverse arch, such as riding boots, choose a low profile model, such as the high heel court model. And remember to always take the factory insert out of running shoes. Additional rear foot wedging may be required to alleviate the pronation and increase the supinatory effect. If symptoms reappear, check the density for correct control on the prescription guide. Choosing appropriate shoe wear is important. Therefore, patients should be encouraged to purchase shoes that do not have arch cutout, but rather a flat base to limit plantar fascial elongation. The shoe should bend at the bisection of the first MTPJ, should provide strength through the body without too much twist, and the heel cup must provide support on each side and at the posterior aspect of the heel cup. Treating patients with ICB orthotic therapy can be very rewarding. However, if the patient complains that the orthotic has lost its effectiveness or has caused pain elsewhere in the body, do not be alarmed, as all you need to do is reassess the patient to identify the problem area.